Friends, uh, first of all, a big thank you to the organizers for giving me an opportunity to be here. I would like to share one thing that some of the most pleasant moments I've had in my consulting room and practices too is often with children and parents with Down syndrome. It is not only because it has been heartening to see them, but it always anytime it's always a professional visit where people are there trying to learn from me or ask me questions or ask me advice. But every visit with a patient and parent of Down syndrome, I felt I've learned a lot. Not just as a doctor, but as a human being. And it is not something just about the receipt, but the children are so nice. In fact, I know one of my patients here, she's here, she's a delight. I just tell her mother that even if she's not alright, just get her, and it makes me feel good. So just interacting with her for 10-15 minutes. So these are extremely delightful moments in my life, and I'm not going to talk to you in technical terms. We doctors are notorious, for just making simple issues very complicated. We'll call a common cold coryza, instead of calling it a simple fever, we call it pyrexia, and so on and so forth. So today but at the same time, since I think the topic which I would like to talk is, I have some responsibility of passing on some information which I think will be valid to you. Down syndrome is vast, as rightly said by the speaker, not only for the lay people, but even for a doctor, it will take a lifetime to understand everything about Down syndrome. Today I'm going to focus on a very common, important issue which parents with Down syndrome come to us. Right from the beginning, they have been told that these children are susceptible to infections, and how do we protect our children? Right at the beginning, when they hear the first diagnosis, among other things about the intellectual capacity, the next thing is, in what way is my child different from other children? And one of the things we tell them is, your child, you have to protect them against infections. So here is a brief sort of a discussion on what real infection is. Parents nowadays, not just a Down syndrome, all the parents say that, give my child, doctor, can you give me something for my child to boost up his immunity? I want my child to be immune. So what is this immunity? Is this something tangible, or is it just an abstract idea? Understand, there are certain illnesses which decrease immunity, but what about immunity? Immunity is just in simple words, an ability of an individual to resist or fight illnesses. So if you take the illnesses to be the bad guys in your life, then your immunity is your entire armamentarium of good guys, good soldiers, good weaponry to combat this. This, in simple terms, that is all immunity is all about. There are different ways. Technically, you can go and break this into antibodies and your cells, but I think that's not relevant in this discussion. We are not here to give a medical discourse. But at the same time, for you to understand what immunity is all about, there is some part of immunity which is called innate immunity. That means you're born with. You're born with a certain amount of immunity. You've got a skin. That skin protects you against heat, protects you against injuries. You're born with that skin. That is not something which you develop. Secondarily, similarly, your airway passage. As you know that your nature is so wonderful, it has devised your nasal passage. It does not go like a straight tube. It goes converted like a roller coaster and then goes. Why is that? Because it protects the dust, the viruses, the bacteria from directly entering. And as you know that when you mouth breathe, you are going to give a direct highway for the infections to go. And that's one of the reasons why children with Down syndrome get respiratory infections, because they have a large tongue. They often tend to keep their mouth open and mouth breathe. So that is something which is a structure. It has nothing to do with the immunity. And you know that being Down syndrome, these children are going to be that way. No way you are going to change. You can't tell a child that close your mouth. He has a problem with nasal breathing. His nasal passage is low. He's going to breathe through his mouth. It's not a habit. It's more of a necessity, and that is going to make the child a little vulnerable. So again, as I told you, these are all medical issues about telling you how the immunity begins. But all it means that, as I always tell even my medical students, that immunity is all about, you are playing a game of football. Why do you have different uniforms? Because you know that you are wearing a red uniform, you have to pass the ball to people with red uniform. Don't pass it to the one with the blue uniform, because he's in the opposing team. Similarly, here your cells are your cells, and they are meant to protect your cells and to prevent you from the other ones. So if your immunity cells are the red shirt guys, they are supposed to say that the blue shirt guys don't get into your body and damage it. So this is all what your immunity is all about. So I will not go through this, except that you have antibodies, your white blood cells are your soldiers, and these are the soldiers which really rush whenever there is infection. So sometimes parents come to us and say, doctor, you know, my white blood cell count has gone up. I said, that's a good thing. That means your body is responding, your soldiers are acting. I'll be worried if your child is having an infection, your white blood cells are not rising. So the interpretation of simple things, and sometimes people feel that there's something wrong with my child's white blood cells. And so that's why my child is continuously falling ill. So anyway, we are now, the second immunity is your adaptive immunity. This is very important to us. Why? Because this is the immunity which you get by your interaction with your environment. So every time you crib that my child has got a viral infection, I say, look at the positive thing. This is your opportunity for your body to get an antibody against this. So this is nature's own vaccination. So that's why if you live in a glass bubble and you just are never exposed to infection, the moment you come out, you're going to be a sitting duck for all the infections to attack you. Because your day-to-day infections, your children play with other children, they are going to get viral infections, but each viral infection makes them more capable of dealing with a similar infection next time. So always look at the bright side of things. That's why we tell the children, don't keep your children away from school. Nobody, doctor in the creche or in the kids' place, there are going to be children with illness. I said, that's what, because you are going to ultimately expose them to the world. If you keep them protected, they are not going to really withstand the trauma when you really come across into the bad world. So this is the adaptive immunity. Similarly, your vaccines, your immunization, you are not born with that immunity. You inject something into the body and the body reacts to that and then generates the immunity. This is adaptive immunity. So in adaptation to exposure to the environment or to something which you do deliberately like a vaccine, you cultivate or develop this immunity. So now I will, as I told you, this is just for people who want to know, but I think this is not in the course. I will straight away go how it affects children. So if you see, this is the overview of what the previous slides were telling. That basically you have your white blood cells, and a simple thing is that you have B cells and T cells. B cells are the ones which directly attack the incriminating substance. T cells are the ones which attack the substance once it has entered the cells. So how does it really make a difference to you? Remember, the B cells or the antibodies act against your bacteria. The T cells act against viruses. And why is it important? Because in Down syndrome, these things have some relevance. So why are children with Down syndrome more susceptible to infections? First of all, are they susceptible? The answer is yes. Unfortunately, they are susceptible to infections. What do you mean by susceptible to infections? Susceptible to infections means that they are more likely to catch the simple infections as compared to the other children. Secondly, if they are suffering from infection, that infection is likely to linger on for a longer period than other children. Third thing is that in certain illnesses, for example, we had an epidemic of H1N1 swine flu 10 years back, and we found that children with Down syndrome are the ones who are likely to get more serious swine flu infections as compared to the other children. And fourthly, is because of their adaptive immunity being less, a particular infection is not necessarily going to grant them the same amount of immunity as it would have gone in a person without Down syndrome. So these are the four things in which these children are more susceptible to infections. Now, forget the medical terms, as I'm sorry, this is compulsive. I mean, I just can't sometimes, wanting to write simple things, I land up writing technical words. But what it means is that there is some sort of immunity which is because of the structural problems. Airway, as you know, Down syndrome, everybody knows that children with Down syndrome have airways which are compromised. You have a large tongue, your nasal passages are narrow, so you are bound to get more dust and you are not likely to filter the air which you are breathing. So these children will have air infection just by the structural abnormality. Children with Down syndrome, as some of your parents must have experienced, have a tendency of bringing out or regurgitating. They have a gastrointestinal, what is called as a reflux syndrome. And when you reflux, you are likely to take reflux, some of the reflux going into the lungs and getting frequent lung infections. And these are non-immune factors, and the immune factor, as I told you, is just because of less antibodies and less capability of white blood cells. So this is what I told you. All that jargon which I spoke in the beginning was just to tell you in Down syndrome, you have reduced number of T cells, you have reduced number of B cells, you have got decreased antibody response to a particular bacteria, decreased antibody response to vaccines, and therefore lesser immunity. Secondly, that word which I said, decreased neutrophil chemotactic activity, what it means that when there is an infection in a Down syndrome, the white blood cells are less likely to rush to the endangered site as compared to children not having Down syndrome. And as I told you, non-immunological factors are the anatomical factors. They have a small ear canal. They have got weakness of the respiratory. That's why sometimes Down syndrome children breathe very noisily. You know, when they breathe noisily, they snore. This is because the airway passage has less, I would say, rigidity, and it's like a toothpaste. When you press a toothpaste, it does not come back. A ping pong ball, when you press it, remains in, because whenever the airway, it just sucks in the bacteria and does not throw it out. So these children will have larger tonsils, larger adenoid problems, so they are likely to have respiratory infections more than the other children. So how does it affect you? So what is the ultimately getting all this? How does it help you in better parenting of these children? So these children, are they likely to have more life-threatening illnesses? Fortunately, the answer is no. The answer is they are more susceptible to airborne infections like viral influenza. If you are going to have a flu epidemic in the city, take your children away from children who are sick. They are likely to get more exposed to pneumonias, and therefore they are going to, most of the infections are related to respiratory passages. It does not mean they are more prone to dengue, malaria. No, they are as vulnerable as anybody else is to get these illnesses. They are as vulnerable as anybody to get typhoid fever. But mainly respiratory passage infections like flu, common cold, tonsillitis, pharyngitis, they are more likely to get ear infections. Ear infections again because the tube from the eustachian tube which goes from the pharynx to from the throat to the ear is normally at an angle. In Down syndrome patients, it's a very short tube and straight. So any nasal infection can directly go to the back of the ear. So, other than that, when you have this typical, what many parents said, baldama, amcha mulal baldama. Baldama is a viral infection which causes frequent asthmatic. These children are more prone than other children to get these infections, and dental infections are more common than the normal other population which is there. So now, with all this in mind, how does it? All of you are excellent parents, all of you take excellent care of your children. You would never allow your children to go in an infected atmosphere. You practice hand washing, you see that good utensils. I'm sure of that. There's no need for me to teach you that. Regarding immunization, now this is something which some parent with the Down syndrome had come to me and said that, is it wise or prudent for my child to get immunized? There is a school of thought that immunization actually affects your immunity and you should not be immunizing. I mean, there's a big lobby. That's besides the point. There is a group of people in the world who believe that immunization is bad and it should not be given. But leave aside that, what about Down syndrome? Does it affect the immunity? Do immunization make their immune system actually more vulnerable? Now, I will speak only as far as my science is concerned and what my knowledge teaches me. And there is overwhelming evidence that if any child requires vaccination, the Down syndrome children require it even more. Because as I told you, these vaccines are not the old vaccines which we used to give, that we used to like steroids or something which suppress the immunity. These vaccines actually stimulate your white blood cells to produce antibodies. There is something called as passive immunity and active, which I think was not a part of my talking, but basically since it's come, passive immunity is where you just give antibodies to a person. Now that theoretically can be taken as a call that if you are giving directly, where the child will not produce and you are suppressing the child's immunity. That's often what happens with steroids too. But what is being practiced in today modern medicine is what is called as active immunity, where you just give a substance. That substance does not give you immunity. That substance stimulates your body immune system to generate antibodies. So body is generating its own immune system. If you accept that to fact of science, then all children with Down syndrome, do you have to give any special immunization to them? The answer is again no. You give the same immunization as you would give to any other child. There is no need to do anything special. However, if Some people do say that we follow, I mean, if doctors nowadays, every time you go to them, they are coming up with a new vaccine. They said, by the time we thought we have finished, they have already said, okay, here's a new list of 3 more vaccines which have come. So, if you are a bit choosy about vaccines, then the vaccines which you must give, and I would stress again and underline, is the influenza vaccine. Flu is there every year, and most of your children get viral infections, or Down syndrome children get flu. Flu vaccine is absolutely harmless vaccine. I wouldn't know whether to give that nasal one, but get the injectable one, because it's a killed vaccine. It's not a live virus which is going to cause any symptoms in your child. It has absolutely no side effects, and it protects you from year to year against seasonal flu. The second vaccine which must be specifically given to Down syndrome, I mean, if you are going to choose and if you are not going to give all of them, is definitely the pneumococcal vaccine. Because pneumonia can be life-threatening in children with Downs more than others, because it depends upon, and because they are extremely likely to take the bacteria right into the lung passages. And if you really are wondering about other vaccination like hepatitis B, hepatitis A, you should give, because these children have a decreased immune response. So actually there was another study, when they did the blood draw, and they found that children with Down syndrome, they had the immune response antibody level was less than the other children. But the good part is, though it was less, it was protective enough. Ultimately, you work with for the efficacy of the vaccine, not if I have level 10 and somebody has level 7, but 7 is good enough, it does not make a difference. I really don't have to strive for level 10. So this is basically my message, which I always felt, and in fact I shared this with who had come to me and said that what should I vaccinate. So I said, this is one thing. I was quite surprised that there is this thought going on among people that we should not vaccinate. I said, probably this is one field which I would like to talk to you. That these children with immunization, you require, if you are having a vaccine influenza epidemic, just see that you don't take them to crowded places. You don't take them to places where the other children with vaccination, with flu are going to be there. And otherwise, I think all of you are doing a great job. And I think my lecture would have served its purpose if you understand that you give the flu vaccine, the pneumonia vaccine, the other vaccinations you can give just as you are giving for any other child. And ultimately, there's another question which nowadays I think people talk, and doctors often talk to you about giving the painless vaccine or the routine vaccination or triple. Here, the routine vaccination gives a better immunity. For Down syndrome children, I think it would be better. I would advise not to give the painless one or cellular one, because it has known to cause a lesser immune response. So technically, give the routine one, not necessarily the things which are the more expensive or more fancied are better. Often the best things in life are free. So prevention of infections by simple common sense care. I don't think you need a doctor to tell you that. I think probably you, with managing your children, know that you would possibly tell me how to do a better job than what I do. And then second thing is vaccination. So this is all we want to see. We want to see these happy children, smiling, healthy, fit always. Thank you very much.
Thank you, Dr. Anil.
As I've heard, it does not cover all the pneumonia strains. It covers just 13. Actually, there is a vaccine which covers 23 strains, but that cannot be given till 2 years of age. So the ideal recommendation is give your Prevnar 3 doses. Subsequently, after 2 years or 4 years, not for every child, but suppose there is a pneumonia epidemic in town, you can give that 23 pneumococcal, which actually is much cheaper. Prevnar is an expensive vaccine. 4,000. So the pneumococcal vaccine is even for all children with immunity deficiency, children with childhood cancers, children who have got some immunity, they are recommended this schedule. That give 3 Prevnar in the first year, and subsequent after 2 years, if need is there, you can give it. So if your child is 10 months old and you are given only at 3 months, you need to give only 1 more. Yeah, you don't need to give 3. No, give 1 more now and give 1 at 1.5 years, because 1.5 years you again give a booster. So you can do with 1 less now. 2. Normally it's 1 year 3 doses, but since you already crossed the 6-month period, you don't need to give the second. You can give you don't need to what I'm trying to tell you, you don't need to restart your immunization just because some time has elapsed. The immunity is there. I told you, the painful and painless is not actually, it's painful because No. For other people, the two actions are absolutely equal. There is no difference between the two as far as efficacy is concerned. But in fact, the painful one may give us shared immunity better. But as I told you, it does not matter actually in clinical practice. But for Down syndrome patients, I would recommend give the painful one because it gives a better immunity. Don't give the painless one. Don't give the fancied and the expensive one, give the normal one. So probably a child who takes vaccines from the government corporation setup will do better than the one who takes from fancied ones. Yeah. No, vaccines are expensive. Yeah, but no. The vaccine, I've calculated for a normal child, if you were to take all the vaccines for till 2 years, you will be spending about 20,000 rupees. It's unfortunate, but it's true. Yeah, but see, what happens is you cannot stop his cough and cold. So this is not a part of immunity. This is a part of allergy. So allergy is nothing to do with immunity. Allergy actually is hyperimmunity because he is going to get dust and the body responds to it. So in any other child, for asthma to treat, you give steroids. So you actually are suppressing the immunity. Allergy is the other spectrum of decreased immunity. When you are allergic, your body is intolerant to that outside substance. So if I enter a room and if there is smoke there and if I cough, it is normal because I am coughing in response to something unpleasant. But I enter a room which is absolutely clean, none of you is coughing, I start coughing, I am allergic, I am coughing to something which I should not be coughing to. And this is exactly what happens in your child when he is allergic, and a climate in which nobody else is falling cough and cold, he is reacting to it. But that with age will come out. Allergies always will go off with age. No, that means it's getting complicated by viral infection. Your flu vaccination every year will at least bring that down. And I don't know, so people like breathing exercise, swimming and these things help in that way because you tend to, how does swimming help? How does pranayam help? It just helps you to clear your airways. That's what you want. These children it's difficult to explain them to clear their airways. That's another problem, you know. You always have stuffy nose, you're running around with them and cleaning them, but you're cleaning the nose. What about the chest? You really can't, it's difficult to relate that bring out and forcefully bring out the cough. That's what's difficult. That's why many of these children, sometimes you go to a doctor, they give you nebulization. That's all.
Need to give that vaccine to the
6
kids?
months onward, first 2 doses, subsequently every year.
So like my son, he's 4+ now.
Yeah, give him every year. The best time to give it is in July because in July is every year the world decides that flu vaccines come in different strains.
Right.
So in July it will be announced that what will be the strain for this year. This comes from WHO. Okay. So you will know that because what vaccination you have given last year, even though 1 year has not passed, if this year's strain is different, you will not be covered by it.
So this vaccination is not covered in the vaccination chart.
This is an additional vaccine.
This is additional vaccine.
And
So
it has gained specific importance in Pune because Pune has H1N1 swine flu throughout the year. I think we are never going to get rid of it. So in
every year we need to give this vaccine.
There's lot of clarity after all those brilliant sessions.